Good evening. I'm Elaine Todd with Todd Financial Services, and I'm here this evening to discuss with you long-term care insurance and some alternatives to long-term care insurance. I'd like to start by telling you a little bit of a story. It's a personal story, but it kind of brings home the meaning and value, actually, of what long-term care insurance is about. It's been a little more than 4 years ago that my parents sold their home and moved into assisted living. They sold the home because Mom couldn't deal with maintenance. She was tired of worrying about getting the yard mowed even, and so I encouraged them to go to assisted living because my father was having early stage dementia signs, and it was time for her to stop worrying about him and have someone else pick up the baton a bit and help her out. So they moved into assisted living, and this is in another state, so I was trying to orchestrate long distance. And they were in a very nice assisted living facility, privately owned, for about 7 months before my dad got sick with pneumonia and went into the hospital. And he had other complications, and when he came out of there, he went into rehabilitation. He was in rehab for about 3 months, and this was all arguing against the doctor because the doctor wanted to just put him in the nursing home and let him decline from there. But he did well in rehab. He got strong again. He was up walking again. But unfortunately, during the time he was there, he was leaving the building without telling anyone. And so when his rehab was up, the assisted living that they had been living in would not allow my father to come back because their levels of care did not meet the needs. And the facility that he was in put him in an Alzheimer's unit where he really wasn't ready to be. He was there for 4 months, and during that time my mother advocated for him to the extent that was unreal to me. She was determined that she was going to get him home with her again. She moved to another assisted living facility that had more levels of care and was able to finally get him back home with her. And he was with her for 30 days when he fell and broke his hip and was in the hospital, and from there to the nursing home where he passed away about a month later. It was a really hard journey, and I had several trips to Texas in the meantime, and what struck me as much as the emotional side of this trip was the cost. My mother could not even fathom writing a check for $7,700, which was for her assisted living and his nursing home care. And when I looked back at this whole story and looked at the cost, her out-of-pocket, or their out-of-pocket costs during that about a 12-month period that my dad was declining, they actually ended up having about $60,000 out of pocket. To some people that may not be a lot of money, but to her it was a very large sum of money. And every time she had to write the check for assisted living and for the nursing home, she was having to almost breathe into a sack because it was a very, very difficult thing for her. And she could see that if he lived very long, that they would be destitute. So I look back at that and ask myself, well, if they had been able to qualify for long-term care insurance, and neither one could because their health was such, even though I've been doing this for almost 25 years, their health was not good enough even that early on to qualify for long-term care insurance. So that was out of the question, but had they been able to, what would have been the difference? So I kind of put some numbers together just today, just to come up with an estimate. And I'm just going to use $100 a day of cost, even though that's about half of what the cost would be today, but $100 a day of home health care. The difference in the bottom line would be that had they had the full insurance with home health care, they would have had out of pocket, the insurance would have paid about $44,000 of the $60,000. So that's significant. So Then we need to talk about, well, what is a long-term care insurance policy? You're really purchasing 5 things with a traditional